161. Which statement made by the nurse describes the inheritance pattern of autosomal recessive disorders? A. An affected newborn has unaffected parents. B. An affected newborn has one affected parent. C. Affected parents have a 1 in 4 chance of passing on the defective gene. D. Affected parents have unaffected children who are carriers. 161. Answer C. Autosomal recessive disorders can be passed from the parents to the infant. If both parents pass the trait, the child will get 2 abnormal genes and the disease results. Parents can also pass the trait to the infant. Answer A is incorrect because, to have an affected newborn, the parents must be carriers. Answer B is incorrect because both parents must be carriers. Answer D is incorrect because the parents might have affected children. 162. A pregnant client, age 32, asks the nurse why her doctor has recommended a serum alpha-fetoprotein. The nurse should explain that the doctor has recommended the test. A. Because it is a state law. B. To detect cardiovascular defects. C. Because of her age. D. To detect neurological defects. 162. Answer D. Alpha-fetoprotein is a screening test done to detect neural tube defects such as spina bifida. The test is not mandatory, as stated in answer A. It does not indicate cardiovascular defects, and the mother's age has no bearing on the need for the test, so answers B and C are incorrect. 163. A client with hypothyroidism asks the nurse if she will still need to take thyroid medication during the pregnancy. The nurse's response is based on the knowledge that A. There is no need to take thyroid medication because the fetus's thyroid produces a thyroid-stimulating hormone. B. Regulation of thyroid medication is more difficult because the thyroid gland increases in size during pregnancy. C. It is more difficult to maintain thyroid regulation during pregnancy due to a slowing of metabolism. D. If fetal growth is arrested if thyroid medication is continued during pregnancy. 163. Answer B. During pregnancy, the thyroid gland triples in size. This makes it more difficult to regulate thyroid medication. Answer A is incorrect because there could be a need for thyroid medication during pregnancy. Answer C is incorrect because the thyroid function does not slow. Fetal growth is not arrested if thyroid medication is continued, so answer D is incorrect. 164. The nurse is responsible for performing a neonatal assessment on a full-term infant. At 1 minute, the nurse could expect to find A. An apical pulse of 100. B. An absence of tonus. C. Cyanosis of the feet and hands. D. Jaundice of the skin and sclera. 164. Answer C. Cyanosis of the feet and hands is acrocyanosis. This is a normal finding 1 minute after birth. An apical pulse should be 120 to 160, and the baby should have muscle tone, making answers A and B incorrect. Jaundice immediately after birth is pathological jaundice and is abnormal, so answer D is incorrect. 165. A client with sickle cell anemia is admitted to the labor and delivery unit during the first phase of labor. The nurse should anticipate the client's need for A. Supplemental oxygen. B. Fluid restriction. C. Blood transfusion. D. Delivery by cesarean section. 165. Answer A. Clients with sickle cell crises are treated with heat, hydration, oxygen, and pain relief. Fluids are increased, not decreased. Blood transfusions are usually not required, and the client can be delivered vaginally, thus, answers B, C, and D are incorrect. 166. A client with diabetes has an order for ultrasonography. Preparation for an ultrasound includes A. Increasing fluid intake. B. Limiting ambulation. C. Administering an enema. D. Withholding food for 8 hours. 166. Answer A. Before ultrasonography, the client should be taught to drink plenty of fluids and not void. The client may ambulate, an enema is not needed, and there is no need to withhold food for 8 hours. Therefore, answers B, C, and D are incorrect. 167. An infant who weighs 8 pounds at birth would be expected to weigh how many pounds at 1 year? A. 14 pounds. B. 16 pounds. C. 18 pounds. D. 24 pounds. 167. Answer D. By 1 year of age, the infant is expected to triple his birth weight. Answers A, B, and C are incorrect because they are too low. 168. A pregnant client with a history of alcohol addiction is scheduled for a non-stress test. The non-stress test: A. Determines the lung maturity of the fetus. B. Measures the activity of the fetus. C. Shows the effect of contractions on the fetal heart rate. D. Measures the neurological well-being of the fetus. 168. Answer B. A non-stress test is done to evaluate periodic movement of the fetus. It is not done to evaluate lung maturity as in answer A. An oxytocin challenge test shows the effect of contractions on fetal heart rate, and a non-stress test does not measure neurological well-being of the fetus, so answers C and D are incorrect. 169. A full-term male has hypospadias. Which statement describes hypospadias? A. The urethral opening is absent. B. The urethra opens on the top side of the penis. C. The urethral opening is enlarged. D. The urethra opens on the underside of the penis. 169. Answer D. Hypospadias is a condition in which there is an opening on the underside of the penis. Answers A, B, and C do not describe hypospadias, therefore, they are incorrect. 170. A gravida 3 para 2 is admitted to the labor unit. Vaginal exam reveals that the client's cervix is 8 cm dilated with complete effacement. The priority nursing diagnosis at this time is A. Alteration in coping related to pain. B. Potential for injury related to precipitate delivery. C. Alteration in elimination related to anesthesia. D. Potential for fluid volume deficit related to NPO status. 170. Answer A. Transition is the time during labor when the client loses concentration due to intense contractions. Potential for injury related to precipitate delivery has nothing to do with the dilation of the cervix, so answer B is incorrect. There is no data to indicate that the client has had anesthesia or fluid volume deficit, making answers C and D incorrect. 171. The client with varicella will most likely have an order for which category of medication? A. Antibiotics. B. Antipyretics. C. Antivirals. D. Anticoagulants. 171. Answer C. Varicella is chickenpox. This herpes virus is treated with antiviral medications. The client is not treated with antibiotics or anticoagulants, as stated in answers A and D. The client might have a fever before the rash appears, but when the rash appears, the temperature is usually gone, so answer B is incorrect. 172. A client is admitted complaining of chest pain. Which of the following drug orders should the nurse question? A. Nitroglycerin. B. Ampicillin. C. Propranolol. D. Verapamil. 172. Answer B. Clients with chest pain can be treated with nitroglycerin, a beta blocker such as propranolol, or verapamil. There is no indication for an antibiotic such as ampicillin, so answers A, C, and D are incorrect. 173. Which of the following instructions should be included in the teaching for the client with rheumatoid arthritis? A. Avoid exercise because it fatigues the joints. B. Take prescribed anti-inflammatory medications with meals. C. Alternate hot and cold packs to affected joints. D. Avoid weight-bearing activity. 173. Answer B. Anti-inflammatory drugs should be taken with meals to avoid stomach upset. Answers A, C, and D are incorrect. Clients with rheumatoid arthritis should exercise, but not to the point of pain. Alternating hot and cold is not necessary, especially because warm, moist soaks are more useful in decreasing pain. Weight-bearing activities such as walking are useful, but is not the best answer for the stem. 174. A client with acute pancreatitis is experiencing severe abdominal pain. Which of the following orders should be questioned by the nurse? A. Meperidine 100 mg IM 4 hours PRN pain. B. Mylanta 30 CCSM 4 hours Viaduct NG. C. Cimetidine 300 mg POMID. D. Morphine 8 mg IM 4 hours PRN pain. 174. Answer D. Morphine is contraindicated in clients with gallbladder disease and pancreatitis because morphine causes spasms of the sphincter of Oddi. Meperidine, Mylanta, and cimetidine are ordered for pancreatitis, making answers A, B, and C incorrect. 175. The client is admitted to the chemical dependence unit with an order for continuous observation. The nurse is aware that the doctor has ordered continuous observation because A. Hallucinogenic drugs create both stimulant and depressant effects. B. Hallucinogenic drugs induce a state of altered perception. C. Hallucinogenic drugs produce severe respiratory depression. D. Hallucinogenic drugs induce rapid physical dependence. 175. Answer B. Hallucinogenic drugs can cause hallucinations. Continuous observation is ordered to prevent the client from harming himself during withdrawal. Answers A, C, and D are incorrect because hallucinogenic drugs don't create both stimulant and depressant effects or produce severe respiratory depression. However, they do produce psychological dependence rather than physical dependence. 176. A client with a history of abusing barbiturates abruptly stops taking the medication. The nurse should give priority to assessing the client for A. Depression and suicidal ideation. B. Tachycardia and diarrhea. C. Muscle cramping and abdominal pain. D. Tachycardia and euphoric mood. 176. Answer B. Barbiturates create a sedative effect. When the client stops taking barbiturates, he will experience tachycardia, diarrhea, and tachypnea. Answer A is incorrect. Even though depression and suicidal ideation go along with barbiturate use, it is not the priority. Muscle cramps and abdominal pain are vague symptoms that could be associated with other problems. Tachycardia is associated with stopping barbiturates, but euphoria is not. 177. During the assessment of a laboring client, the nurse notes that the FHT are loudest in the upper right quadrant. The infant is most likely in which position? A. Right breech presentation. B. Or right occipital anterior presentation. C. Left sacral anterior presentation. D. Left occipital transverse presentation. 177. Answer A. If the fetal heart tones are heard in the right upper abdomen, the infant is in a breech presentation. If the infant is positioned in the right occipital anterior presentation, the FHTs will be located in the right lower quadrant, so answer B is incorrect. If the fetus is in the sacral position, the FHTs will be located in the center of the abdomen, so answer C is incorrect. If the FHTs are heard in the left lower abdomen, the infant is most likely in the left occipital transverse position, making answer D incorrect. 178. The primary physiological alteration in the development of asthma is A. Bronchiolar inflammation and dyspnea. B. Hypersecretion of abnormally viscous mucus. C. Infectious processes, causing mucosal edema. D. Spasm of bronchiolar smooth muscle. 178. Answer D. Asthma is the presence of bronchiolar spasms. This spasm can be brought on by allergies or anxiety. Answer A is incorrect, because the primary physiological alteration is not inflammation. Answer B is incorrect, because there is the production of abnormally viscous mucus, not a primary alteration. Answer C is incorrect because infection is not primary to asthma. 179. A client with mania is unable to finish her dinner. To help her maintain sufficient nourishment, the nurse should A. Serve high-calorie foods she can carry with her. B. Encourage her appetite by sending out for her favorite foods. C. Serve her small, attractively arranged portions. D. Allow her in the unit kitchen for extra food whenever she pleases. 179. Answer A. The client with mania is seldom sitting long enough to eat and burns many calories for energy. Answer B is incorrect because the client should be treated the same as other clients. Small meals are not a correct option for this client. Allowing her into the kitchen gives her privileges that other clients do not have and should not be allowed, so answer D is incorrect. 180. To maintain Bryant's traction, the nurse must make certain that the child's hips are resting on the bed, with the legs suspended at a right angle to the bed. B. Hips are slightly elevated above the bed and the legs are suspended at a right angle to the bed. C. Hips are elevated above the level of the body on a pillow and the legs are suspended parallel to the bed. D. Hips and legs are flat on the bed, with the traction positioned at the foot of the bed. 180. Answer B. Bryant's traction is used for fractured femurs and dislocated hips. The hips should be elevated approximately 15 degrees off the bed. Answer A is incorrect because the hips should not be resting on the bed. Answer C is incorrect because the hips should not be above the level of the body. Answer D is incorrect because the hips and legs should not be flat on the bed.